Welcome back. With us right now from the Interventional Cardiology Department at Saddleback Memorial Medical Center is Dr. John Bahadurani. Nice to meet you, sir.
Nice to meet you.
Welcome.
Thank you. Thanks for having me.
Great to have you here today. And February is National Heart Awareness Month, right?
Every month is Heart Awareness Month.
Yeah, every month
February
should
in particular.
be. Valentine's Day, of course, right? It's always interesting. Valentine's Day and candy and all that, but chocolate, a little chocolate's good.
Dark
for
chocolate's
you, right?
good, yes.
So let's talk about your department first of all and a little bit about your background.
Sure. So I am an interventional cardiologist,
okay.
Which means that within the realm of cardiology, I deal specifically with being able to open up blockages minimally invasively by putting stents in to avoid having to go for open heart surgery.
I see. Okay.
Primarily at Saddleback Memorial Hospital. I started my roots over at UCSD as faculty there.
Okay.
So.
Now, speaking of that, peripheral vascular disease, how does that differ from what somebody would call, the classic heart attack? And what is, when somebody says heart attack, it can be one of several different things, right?
Right.
It's kind of a catch-all phrase nowadays.
Right. So to start, heart attack basically is when there is a mismatch of oxygen demand to the heart muscle versus the actual amount of oxygen being delivered.
Okay.
And so the most common way that happens is that there's a blockage in the artery of the heart.
Okay.
And that doesn't allow the blood flow to be adequate for supplying oxygen to the heart muscle, and that causes the heart muscle to die.
Okay.
That's your traditional heart attack. There's a whole host of other ways that people can have that demand mismatch, but that is the most common.
Okay, and that heart muscle can actually, or parts of it, could die very quickly, right?
Very quickly. There is actually a specific type of a heart attack that special centers across the country, which are called cardiac receiving centers, such as Saddleback Memorial Hospital, that can take care of these patients. And so, for instance, when someone comes in with that classic heart attack, it's usually 100% blockage in the artery that happened in a very acute setting. And so in that instance, time is heart muscle.
Right.
Recognizing those signs and getting to the hospital quickly are very important because I have about 90 minutes from the time that a patient comes into the hospital to open up that artery to save as much heart muscle as I can.
Okay. And tell us then again about the peripheral vascular disease.
Sure. So just like having atherosclerosis or blockages in the arteries of the heart, you can get them in other vessels. So peripheral artery disease or peripheral vascular disease is blockages in non-cardiac vessels. The legs, the arms, the arteries of the neck that supply blood flow to the brain. And so what we know is that the same risk factors that apply to patients developing blockages in the arteries of the heart apply to developing blockages in other blood vessels. And we know that, in fact, people that have peripheral vascular disease, if you look at studies, somewhere as high as 40% of them also have abnormalities of blockages in the arteries of the heart.
Okay.
So they work very much hand in hand.
So what are some of the ways that you can prevent that? And also, how do you test for that? Or do you just get a patient history, or is it some sort of overall test just that becomes routine that you can just kind of find out if they're susceptible?
Right. So I think I like to break it down for my patients into 3 things to really kind of get your handle on. Number one, I think visiting your doctor is very important. When you go to see your doctor, they take a history and they do a physical exam. Beyond that, they check blood work, electrocardiogram, and if enough risk factors are present, your physician may elect to refer you to a cardiologist or order a stress test as a screening. The second part of it is risk factor and lifestyle modification. This is probably the most important thing that patients on their own can get a handle on. If you're a diabetic, it's very important to have your blood sugars controlled. If you have high blood pressure, it's important to have your blood pressure controlled. And then diet and exercise are very important. You'll see a lot of things kind of floating out there in terms of what the adequate or most appropriate diet is. And what I like to tell my patients is don't get bogged down into the specific name of a particular diet, but try to focus on a couple of good recommendations, such as eating fruits, vegetables, whole grains. If you do have dairy products in your diet, then low-fat dairy products. And trying to stay away from meat, but if you do go for meat, then poultry and fish staying away from the red meats.
Okay, what about treatment options when you realize this person is susceptible to this and we got to get it under control beyond just what you just said?
Right. So beyond what I just said, so we have medical therapy, and so cholesterol management with statin therapies are very important. Aspirin is very important.
Okay, yeah, let me stop you there
Sure.
for a minute. That is something, of course, we've heard over the years. Taking a baby aspirin, of course, nowadays they have the, what's it called?
Enteric-coated.
Enteric-coated aspirin. Should somebody, once they reach a certain age, should that be just a routine, taking one of those a day? Is it bad for you? Is it good for you?
So aspirin does increase your risk of bleeding.
Okay.
And it, by nature, the way it works. So I think it's important to take each patient individually.
Okay.
If you have risk factors for coronary disease, then it's important to be on an aspirin therapy. But I wouldn't make a blanket statement that everyone past a certain age should be on aspirin.
Okay. All right. Very good. And tell us about your receiving center over there. Obviously, you within this area, you're known for that, right? This
Correct.
is where if somebody within the area is and experience a heart attack or heart problems, more than likely they'll go to Saddleback, right?
Correct. So we are a cardiac receiving center, and what that means is that if someone has an acute heart attack where there's a 100% blocked artery that happens in an acute setting, the EMS services will bring them to our hospital, and I'll be notified, and I come in and I open up the blockage and restore blood flow back to the heart.
Okay.
I think as a patient, it's very important to recognize the early warning signs and not to ignore the symptoms of a heart attack.
What are going to be some of those symptoms? If you have not gone to your doctor recently, what might be some of those symptoms?
Right. So the classic symptoms, and not everyone reads the textbooks, but the classic symptoms is a chest pain or pressure that's in the middle of the chest. Some people have described it as like an elephant sitting on my chest.
Okay.
It occasionally radiates to the left shoulder or arm and the jawline.
Okay.
It can be associated with shortness of breath, beading of sweat on your forehead, feeling nauseated, and it usually occurs with exertion and is alleviated by rest. Now, there are outside types of symptoms that can happen outside of that realm, and women in particular don't necessarily manifest in those classic symptoms, and so it's important for them to be aware of shortness of breath or decreased functional capacity, because a lot of times those are their first symptoms.
Okay. And the other question I have is, sometimes people will mention, or you'll hear this, where, well, I had a mild heart attack. I didn't even realize it till I went to the doctor like a week later or something, and they examined me. Is that true?
Yeah, there is.
Is that where maybe there's a slight little blockage and then it passes, or?
Well, there is an entity called silent MIs.
Okay.
And so these are heart attacks that people don't feel the symptoms for, and it happens somewhere on the order of 10% of all heart attacks. And I think that there's a lot of variables as to why that happens. There are parts of the heart muscle that are not innervated as well as others, and so maybe they don't feel the symptoms. Sometimes people actually felt the symptoms, but they didn't recognize what exactly they were, and so they tell people that they didn't have symptoms. And then finally, diabetics, I think, are a special population that are at high risk for this, because in diabetes, they don't have the classic nerve endings that, or I should say their nerve endings have been affected by the disease process, and so they don't feel symptoms the same way. Okay,
all right, very good. So the big thing is, go to your doctor regularly.
Right.
And give them your history, and then from there they're going to kind of take it in whatever direction they see fit, right?
Exactly. And as a patient, take ownership of your own care. I think diet and exercise are very important. Remember, the American Heart Association recommends 45 minutes a day of exercise, moderate to vigorous.
All right, very good. And as good as this doctor may be, and the department over there at Saddleback, it's not somewhere you really want to go.
Right.
Am I right?
You don't want to have to see me unless you have to.
Yes, unless he comes and does as a speaker in one of the clubs or something like that. But you know what I mean by that.
Correct.
All right, let me give you the website, by the way. It's memorialcare.org/SB Heart. Doctor, thank you very much.
Thank you for having
me.
me.
Pleasure. We'll be right back.